afterwards. Welcome to our panel discussion on the benefits of vaccination beyond specific diseases prevention. This is part 3 of a very important series. Today, we gather to explore a topic that is not only critical, but profoundly timely given the global challenges we face. In an era of evolving healthcare landscapes and shifting demographics, it's important to understand the multifaceted advantages of vaccination that go beyond individual protection from diseases. It encompasses broader societal well-being, economic stability, and most importantly, the enhancement of lives. Before we begin today and have a great discussion with our panelists, I'd like to go through some very quick housekeeping. Very quickly introducing myself, my name is Lina Bader. I'm the FIP Lead for Equity, Sustainability, Policy and Development. Supporting me in the background is my colleague Nour Eltahla. She's the project coordinator for the same program, and various staff members from FIP helping me make this event possible. Some announcements. So this webinar is being recorded and live streamed via YouTube. The recording will be available on the YouTube channel, but also on our website, events.fip.org. You may feel free to ask questions using the question box provided in the Zoom control panel, and we'll be happy to try and pick those up for the panelists later. You are, of course, welcome to provide feedback to FIP about our events, and if you aren't already, please have a look at the FIP website to better understand the benefits of becoming a member of FIP. A quick acknowledgement to say that this webinar is sponsored through unconditional funding by GSK. Today, we have 3 objectives. One is to enhance the understanding, our understanding, all of us, of disease burden and the impact of vaccination. How we can use this information to strengthen resource utilization and implementation strategies, especially across pharmacies, and also highlight proficiency in vaccination management through case studies that we'll hopefully hear from our panelists today. We've delivered 2 events as part of the series already on the 21st of August. Part 1 was the first event of the series. We delved into the technical and evidence-based insights on positive downstream effects of vaccines, especially in older adults, including that on cardiovascular events and diseases, diabetes, and arthritis. Part 2, later in August on the 31st, experts shared contributions, activities, tools that pharmacists lead and utilize to promote healthy aging in the practice setting. The webinar also highlighted the varied but crucial role of pharmacists in vaccination, particularly for older adults and supporting patient quality of life. Those 2 events that have already been delivered are primarily knowledge-based ones, and today's event plus a 4th and final event coming up in October will be more discussion-based events. We have a couple of esteemed panelists from event 2 joining us again today to continue the discussion, and I'll be introducing everyone very shortly. So we have 4 panelists today, and I'll be very honored to introduce them one by one before we commence discussion together. And just as a reminder, we will publicize this sooner to the date, but the final and 4th part of the series will take place on the 23rd of October. And as usual, FIP will promote and publicize the program a couple of weeks before the event. So, without further ado, I'd like to start introducing our panelists. We are joined by Esther McNamara from the UK. Esther is a Senior Health Policy Lead at the International Longevity Centre. She joined the Centre in November 2022 as a Senior Health Policy Lead. She has worked on a range of projects, primarily leading on ILC's adult immunization work and on trial and error. Trial and Error is a report that provides practical steps to increasing older patients' participation in clinical trials. Before ILC, Esther worked with researchers at Cicely Saunders Institute at King's College London while studying for her MA in Public Policy. Thank you so much, Esther, for joining us today.
It's a pleasure to be here.
Thank you so much. Our second speaker is Dr. Jane Barrett. She's the Secretary General of the International Federation of Aging. Dr. Jane Barrett is the Secretary General of the Federation, which is an international NGO with general consultative status at the United Nations, and its agencies include the WHO, World Health Organization. Her leadership drives the agenda for the world's population aging within the UN Decade of Healthy Aging. Among her many current positions, Jane is a member, Vision Academy, Director, Baycrest Health Sciences, Co-Chair, Baycrest Academy, Associate Scientist, Sinai Health System, and a member at many other initiatives. Thank you so much, Jane, for joining us today.
Good to be with you, Lina.
Thank you. Our third panelist is Peter. Peter Guthrie is a senior pharmacist, strategic policy from the Pharmaceutical Society of Australia. Peter holds the position of senior pharmacist at the Society, with the government recognized peak body for pharmacists in Australia. Peter supports policy development, advocacy activities, regulatory submissions, and practice advice. In the past year, Peter has driven practice advice for pharmacists responding to COVID-19 and the association's medicine safety agenda. He maintains practice as a community pharmacist, working in an after-hours role in one of Melbourne's 24-hour supercare pharmacies, with a strong focus on primary care services such as vaccination, triage, and referral of acute symptoms, opioid pharmacotherapy, and provision of medicines information. Thank you so much, Peter, for joining us today.
Thank you. Wonderful to be here.
It's our absolute pleasure. And last but not least, we have Sachiko Ozawa joining us from the United States. Sachiko is an associate professor at the University of North Carolina at Chapel Hill, UNC Eshelman School of Pharmacy. She's also an adjunct associate professor in maternal and child health at UNC Gillings School of Global Public Health in the United States. She is a health economist whose work focuses on generating evidence to improve access to vaccines and quality-assured medicines, working at the interface between pharmacy and public health. She has published over 80 articles in peer-reviewed journals, conducting research on the value of vaccines, the economic impact of substandard and falsified medicines, and the threat of illegitimate online pharmacies. Thank you so much, Sachiko, for joining us today. And welcome.
Pleasure to be here.
Without further ado, I'm really excited to start the discussion. So I'm going to stop sharing the screen so we're all together here on the screen for all our participants to say. So I have prepared some questions for our speakers, but of course, I hope that this will be a very flexible discussion and we welcome questions from the audience as well. I'll start with Esther, actually. Thank you again, Esther, for being with us today. Let's start with how do you see the aging population's impact on disease burden, and what role do vaccination strategies play in promoting health and longevity?
Thank you. I mean, the key starting point with this is we all know that we'd prefer to be well than unwell. And the first thing I noticed when I began the project on cost effectiveness of immunisation that we're currently working on at ILC UK, it's much easier to measure how much we have to spend on immunisation and how much we lose in paid work when people are off sick. Those are the things we're very clear on. But that's only a very small fraction of the picture. So I know that if I were off with COVID, I would miss my paid work. I wouldn't travel. I wouldn't spend money in the same way that I normally do. I might have unpaid care that wouldn't be provided by myself, that might have to fall to someone else. So anecdotally, all of us know the impact that ill health has on our lives at that level. So when we take a sort of top-down view from the population level, that looks really different. So data on the cost and benefits of childhood immunization can often be more readily available than for adults, for a variety of reasons that I'm sure we'll get into. Nevertheless, we know that in 2019, hospitalisation in England, specifically due to pneumococcal disease, cost nearly £4,000 per patient, with a total cost of over £700 million to the NHS. Now, an individual can pay £30 for a pneumococcal vaccine, and I'm sure the cost to the NHS or to a provider would be lower than that. So healthcare costs are one clear part of that. We also know from ILC research conducted in 2019 that in the 50 to 64 age bracket, seasonal flu cost around 159 million working days in 2018, just in OECD countries. That's from our report, Lost Time, Productivity and the Flu. Every year we have the discussion with seasonal flu, is it cost effective? Is it worth us recommending this to which age groups? We've got an ongoing discussion about that in the UK at the moment. And again, these are only the things that we can measure. How do we measure not providing unpaid care to a family member, or the spending that we may or may not have spent? There's so many pictures to this puzzle. And I'm really looking forward to hearing from everyone else on this as well.
Thank you, Esther. That's a really comprehensive answer. And I think it's really important to, especially to our pharmacists listening in, to hear about the indirect costs of low vaccination rates beyond what usually comes to the front of our minds. So I'm going to go to Jane with my next question about older adults specifically. So we know that this group of patient population are often more susceptible to diseases. How can vaccination initiatives be tailored to meet the unique needs of this demographic, while of course still addressing global health challenges?
Look, thanks, Lina. I think we need to step back for a moment and say definitively, older people are not only often susceptible, they are susceptible to communicable diseases. And pharmacists know that. Older people are not a homogeneous population. They're heterogeneous, just like we are today. Older people, me, you, as we grow older, the likelihood of chronic comorbid conditions, diabetes, respiratory conditions, heart conditions increases. And so we not only have healthy older people, but we have older people in the trajectory that have more and more chronic diseases. And so we have a layered effect of risk. So that's the first thing. And we know that's because of immunosenescence, but also the weakened immunity system, and chronic comorbid conditions actually lays that on. So if we look at that, our population goes way beyond healthy older people, and we need to stop talking about patients and talking about citizens, because I think that's really challenging. When we talk about patients, then someone will say, well, I'm not a patient. I've got heart disease, but I'm not a patient. So it's about language is really critical. The rights of older people are human rights. And so when we look at, how do we ensure, first of all, there is a comprehensive national immunisation strategy, we've got to look at the disparity. We have WHO targets for influenza in Europe at 95% for children and 75% for adults. Why is that so? Why is the life of a person in their 60s and 70s any different from the life of, a child who is 10 or 15? And so we have real issues around equity. There are unique ways to target certain at-risk groups, and we'll go into those at a greater detail. But my key points in this is not a homogeneous population, heterogeneous. We're not only talking about older people, we're talking about people with chronic comorbid conditions that are at risk. And we need targeted strategies, and we need national immunisation plans that are across the life course and are not predominantly, in the early stages. Most important, but let's get some equity in timely, affordable and accessible vaccines. Thanks, Lina.
Thanks, Jane, for that. Thank you so much. Peter, I'm going to go to you as a leader in pharmacy and representing maybe professional associations. So from the perspective of the profession and maybe learnings in Australia specifically, how can community pharmacies actively contribute to increasing vaccination rates and promoting public health, obviously beyond specific disease protection, which is the topic of today, and taking into consideration everything Esther and Jane have just said?
Well, I was going to open and say what a wonderful introduction we had from Esther and Jane, because it really highlights some of the challenges, but also the opportunities that community pharmacists are able to sort of look through. Community pharmacists in Australia, there are about 6,000 pharmacies in Australia. We have a population of 25 million, and it's easier to access a pharmacy than a supermarket, a doctor, or a hospital. When you're looking at a population that we're all different, we all have unique needs, accessibility is a really key part of being a great place to have those conversations and messages about vaccination. There's probably about a few different parts of the role of a community pharmacist in Australia. It's a role that I'm proud to be part of, that provides opportunity to talk about vaccination. And one of those that I really focus on is actually when you're vaccinating for one disease, you've also got the opportunity to talk about other diseases as well. And everyone's motivators are different. Some people will be motivated by talking about their health. Others will be motivated by these secondary benefits, the indirect benefits of vaccination that this workshop and this webinar is looking at. It's about having a healthy life. It's about being able to care and support for their family. It's being able to participate in holidays. And without being, got to be careful about generalizations, because every vaccine has a different purpose. Some are preventing transmission, others are preventing death and hospitalization, but the secondary benefits are substantial. While people might not be worried about an influenza illness or COVID-19, they may be really worried about other non-communicable diseases that they could be at high risk of if they experience those. So some of those conversations are important. So the time of giving a vaccination, really important time to be talking about other vaccinations, and why looking at some of those national schedules, and we're lucky to have a national schedule that does look at risk in older people in Australia. It'd be great to see a couple more vaccines on that list. But we do have some vaccines that are routine and government funded for people who are at particular age stages of their life. And we'll see from the 1st of January next year in Australia where pharmacists will be paid an administration fee. Again, that's going to incentivise those conversations in a pharmacy setting. Other times where you might be doing a medicine review, just like you'd ask about smoking status, just like you'd ask about whether people take their medicines, you should also be asking about vaccination and use that as part of what people want from their life, what they want from their health. But also pharmacies represent a great opportunity to lead through example just by conversations. And so that there's a lot of opportunities there. And I think most people are over talking about illness. If you can focus on some of those secondary benefits and some of those indirect benefits, there are huge opportunities there, and people tend to relate really well to that because it's a message they probably haven't heard before.
Thank you, Peter, for that pharmacy tailored perspective. I'm going to go to Sachiko. And Sachiko, I'm going to maybe stay with you for a couple of questions because the next two questions are really linked to each other. But you provide the really important perspective of health economists as well. So as a health economist, how can economic analysis help us make better use of resources in vaccination programs, especially in regions maybe with limited resources?
So countries with limited resources, we're talking about low and middle income countries, need to make decisions on how they're going to allocate those limited resources. And that's where health economics really comes into play. The value of using the economic evidence is to be able to allocate those resources most effectively and efficiently and equitably. And so oftentimes you could make a decision for resource allocation without that evidence, and you would find that you're not actually maximizing the value of those resources. So by utilizing the health economic tools, you're actually able to better allocate and make better use of those resources. Now, what's also really important to note with the economic evidence is that you get to talk to different people. Oftentimes we're spending all of our resources talking within the health community and how we're going to allocate resources within the Ministry of Health budget, for example. But we really should be opening it up so that we can talk to politicians, we can talk to ministers of finance, so that we can actually have more resources allocated toward health. Because health is not just one sector, it actually affects everything else. It can really impact the economy and the economic development. How well people are feeling and doing really impacts the society overall. So I think it's important for us to not just think of these economic tools as something to improve our health, but also the society overall.
Thank you, Sachiko. It's really important to describe why health economy matters in this case. And A lot of us probably need to educate ourselves better on this. So I'm going to stay on this with you with one more question and ask, what methods and approaches would be particularly effective in assessing the economic impact and value of vaccination programs, in your opinion?
Great. So what's most important to remember with vaccination and demonstrating the value of vaccination is that you actually have to have a counterfactual of what happens if you don't vaccinate people. And that's where modeling comes in. We tend to have to model what the value would be if you don't vaccinate compared to if you do vaccinate, and then you look at the difference to be able to show the additional value of that vaccination. Sometimes showing what it would be like if we didn't have, let's say, DTP vaccine from many years ago might be challenging because many things have been changing over the course of the years. But we need to show that difference and what the benefit would be of introducing new vaccines and scaling up coverage of vaccines. And looking at it across the different vaccines as well, then you get to really see what the benefit would be of the vaccination. There are lots of different tools that we can utilize. So cost effectiveness analysis are what most people are familiar with, where we're coming up with cost per DALYs or cost per QALYs. That's disability adjusted life years or quality adjusted life years. And you can measure these both in terms of the cost of the immunization program, the cost of treatments and the hospitalizations, as well as the effectiveness of vaccination in preventing cases and deaths and disabilities. So you're putting those two together in order to come up with a cost effectiveness. But the challenge with those cost effectiveness analysis sometimes is that it's difficult to interpret what a DALY or a QALY is to a policymaker. And especially if you're talking with people in the Ministry of Finance, they actually want to know what the cost benefit is or the return on investment is. And so that's another term that we can use where we can actually turn those effectiveness measures into dollar amounts. So we can then say, what is the value of a life saved using tools like value statistical life so that we can then say what the return on investment would be of immunizing individuals. And we've been trying to generate more of that evidence to communicate to people outside of health so that we can make a better case for health overall.
Thank you, Sachiko. That's really great. We'll come back to how we can use all of these tools and approaches to influence policy, but I'm going to go back to some of the other panelists to talk about the role of health organizations in general. And I know most of you represent one at a global level, some national, but regardless, a leadership organization. So I'm going to ask Jane a very general question, maybe a bit big, but what role can international organizations play in advocating for fair and equitable access to vaccines for older adults?
Look, it's a big question, but it's not a big question. But before I respond, I just want to make a comment about Sachiko's response, which is really, really important. But what we're talking about here is not only lives saved, it's function maintained and improved, because we know that those that are dead, right? That's a life lost. But those that actually survive COVID and long COVID, the impact on not only the formal care system, but the family care system is decades that we actually don't even have a number on yet. And so that's why it's so important to think about not only lives saved, but function, the functional ability to live independently, to live with services in, or are we actually looking at, a decade or more of younger people with compromising conditions being in long-term care facilities, and that's the reality. So I'll go back to the question, Lina. So what do we do as international organizations? For IFA, we advocate, which means we influence policy. That's what we do when we say advocate. We influence policy at an intergovernmental level. So the IFA is working to make the connection between the UN Decade of Healthy Aging, the immunisation agenda, the Sustainable Development Goals, because the language that they talk about is life course. That's the language. But because they actually live in bubbles, they're not making the connection. So we advocate, and during the pandemic, the IFA analysed technical guidelines and found that they were all over the place. And if they actually brought all of those technical guidelines that talked about older people and those with compromising conditions together, it would be more helpful. So that's the way that we work. We also contribute to the pandemic discussion. But just on that, we have a pandemic treaty coming up. So why don't we have a treaty around routine immunisation across the life course? Now, how do international organisations actually work at a country level? What happens at an intergovernmental level needs to be pulled through the principles of these agendas. What does it look like in Australia or Namibia or Nigeria? Because that's where policy actually hits the ground running. And so while we can have guidelines and agendas at the WHO and UN level, or even a regional level, our responsibility, IFA, is to help build the capacity of organisations on the ground. Council of the Ageing in Australia, ILC UK, Age International. So how can we work with our expertise in knowledge and content to actually operationalise those policies at a country level? So it's about working to influence policy at a vertical and helping to build the capacity at an operational level. One point, it's vitally important that we don't talk to the people that we like. And I say that because it's very easy to talk to geriatricians and gerontologists, but it's much more difficult to talk to diabetologists and pharmacists. And that's why the IFA and FIP has such a close relationship, because we have a common agenda, we come to it from different perspectives, and that makes us much more powerful and solid. Thanks.
Thank you, Jane. It's certainly very easy to always talk to you, I can say that. And I completely agree with this really sound advice. Esther, you're representing the International Longevity Centre, so maybe a similar perspective following on Jane. Can you share some strategies and policies maybe that the centre is working on to explore making vaccination programs better?
Of course. One thing that we do have, we're very lucky to have as a think tank, is we can just offer our ideas, and then we're not the ones having to actually do it. So our job is much easier in a lot of ways. But I do have 4 specific strategies that we would suggest that all policymakers, all stakeholders in this space take account of. The first you very helpfully plugged in my introduction. Thank you for that. That's Trial and Error, which is a report we wrote urging all stakeholders in clinical trials to improve more older people, specifically the oldest old. Because what we found was a lot of clinicians will want to offer a medication or a vaccination or other intervention, but the evidence for doing so for a patient who might be older or has ongoing medication or other conditions, they don't have the data that they would need to comfortably make that prescription. So more older people and more data, definitely. The second is opportunistic vaccination, which pharmacists may be well placed to take up. So when patients are consulting about something else, taking that opportunity to say, while you're here, have you thought about X, Y, Z? But this relies on my third point, which is broadening immunisation in medical schools and across all healthcare practitioners. What we've found in our programme of work so far is that even in medical schools, immunisation is too often relegated as a paediatric question. Immunisation, that's for paediatrics or possibly for geriatricians, or for maybe some specific specialities, such as a lung consultant may say, have you had your flu jab? But we need a really solid base of education for all doctors and all healthcare practitioners to feel confident advocating for immunisation. If they're sitting across from a patient and they think, I've seen that I should probably recommend the shingles, but I'm not comfortable, I don't feel I have the up-to-date knowledge that I would want to confidently give that suggestion. So then it doesn't happen. One of the ways that this can happen can be nominating vaccination champions in each healthcare centre or pharmacy, with a named person whose job it is to consult with patients who are anxious or hesitant, because obviously vaccination is everyone's responsibility, but when it's everyone's responsibility, it's no one's. So that's one way to get around that. The fourth suggestion we would make is take the time to understand hesitancy, because that's a lot of what we're coming up against. Most of the time it's anxiety, and people are right to be cautious and approach with caution when making these decisions. And also, I'm sure we'll get onto the prevalence of anti-vaccine misinformation, disinformation online, which only complicates the picture further. But if people reach for information and their clinicians aren't confident in or aren't proactive in disputing what they find online, it can sometimes be too late. And there's a very complicated pathway from vaccine hesitancy to later acceptance and understanding. So those are 4 very quick, brief suggestions. Thank you.
Thank you very much, Esther. Lots of the themes of these projects are also common with some of FIP's programs, especially vaccine confidence and hesitancy, very important on the agenda. Going to Peter, maybe again, the Australian Association works with FIP at the global level, but obviously it has most important influence nationally. So could you tell us about successful collaborations between the society and public health agencies that have significantly improved vaccination management in Australia? We'd love to hear from this, and other member organizations, I'm sure, on the call would love to.
Oh, thank you. I think some of those points we've already had. One of our roles is advocacy, so it's to influence policy, and probably every bit of policy that we've influenced over time is a little change. But then if we look back to having no vaccinations administered by pharmacists less than 10 years ago in Australia, the summation is a massive change to the point where we now have 50% of the ongoing booster program in Australia is administered by pharmacists through a community pharmacy, and about 25% of the influenza vaccines in Australia are now administered by a pharmacist through a community pharmacy. And that hasn't just happened. That's been part of some really great laying the groundwork with one state government a long time ago that put in an influenza trial, and we worked very hard to be part of the consortium that was part of that, and to then see the successful results, and then eventually other 7 jurisdictions in Australia then adopted a similar policy where pharmacists could administer an influenza vaccine once they'd done training. PSA has been the leading provider of that training, and we then, Esther was just referring to information gap, we were then also providing education and annual updates to pharmacists. So part of those collaborations with government have been to ensure that the correct and accurate messaging is passed on to the profession so that they can then pass that on to patients. Because when we're concerned about misinformation or angst about vaccination, a strong recommendation from your health provider is one of the strongest predictors of vaccine acceptance. So it's absolutely critical that those vaccine providers have the best evidence, most up-to-date information before someone brings something in that they've found either on TV and online. And certainly in the pandemic, we went from sending out a training module or doing a periodic update to, I was live blogging press conferences with chief medical officers and leaders as they happened, because I don't know if it didn't happen so much overseas, but we had people tuning into live broadcasts of announcements through the pandemic about the vaccine strategy and other pandemic measures. And it was really critical for us to be able to pull out what was the most important information for pharmacists about vaccination, about other measures, and get that to them, so that when people from the public came into the pharmacy and said, I've just seen this on television, they were armed with the most up-to-date information, because it's important that they maintain trust in their pharmacist. And we've seen today in Australia, the trust scores are coming out for professions, and pharmacists are sitting at number 3 behind firefighters. And I don't recall the other one, but I don't think it was nurses this time, but it often is in the top 3. Other partnerships with governments have been really valuable. We were part of, particularly through the pandemic, but also through other things like the annual influenza groups and some other partnerships around other vaccine strategies. We have our teams around the country part of those discussions and helping inform and then communicate messages out of those. And that's a really important part of being effective. And I think one of the really effective ways that we had was we had weekly meetings with our chief medical officers or the deputy chief medical officers that involved personnel from our organisation and at state equivalent level. So it was a very quick flow between information, and That doesn't just build trust, but it also means that policy is effective. But it also means now after the pandemic that we've established structures that will be benefiting us long term as a community in having more effective vaccination policy. And what I mentioned earlier, we'll be having more vaccinations run through pharmacy from next year because of change of the funding structure. That's because all of that really hard work we did in the pandemic and the profession, like I did a few, but I wasn't the one doing 11 million vaccinations. The profession delivered that, and they delivered that really, really well. And because of that, we now have the confidence of government to move to the next level. So that's a relatively long answer to sort of go through that. It's not just one initiative, it's not just a few discrete projects, but it is building and finding those opportunities and working collaboratively on something that's actually now quite a special part of the way we vaccinate in Australia. If we look back 10 years, there wasn't a single vaccination administered by a pharmacist. So in a relatively short pace of time in the history of medicine, we've seen a very, very massive change in the way that works here in Australia. It's something that I've been very proud to be part of.
Thank you, Peter, and congratulations on all the work. And we know from our other members that the pandemic has sort of been a policy accelerator for pharmacy vaccination. And I guess that's the silver lining of the whole pandemic, or one of them. I'm going to go to you, Sachiko. Peter just spoke about how about working with governments, and maybe coming back to that. In your view, again, from maybe more of a health economy perspective and wider, what are some of the key factors that policymakers should consider when deciding how to allocate resources for vaccination, and how can we influence that?
Great question. I did want to follow up with Peter's comment that it's really important to continue the efforts that we actually built during COVID and not let it come back to where we used to be, so that we can actually continue to build on it and utilize the lessons that we learned as pharmacists, and advocate for our profession. So just wanted to note that. In terms of advocating, wanted to note that these cost effectiveness or cost benefit analysis may not be comprehensive in terms of what it's actually measuring. And I think this is the value of this webinar, to talk about what are these additional benefits of vaccinations that we're not necessarily selling well when we're talking with policymakers. So we talked about earlier about some of the health benefits that we tend to think about, which is the cases that are averted, the deaths, the hospitalizations that are averted, the functions that Jane just mentioned, and maybe some things about distress to the family. But what we're really not measuring are things like the ability for vaccines to control antibiotic resistance. And we can actually start to measure it. We've been trying to develop some models to try to estimate what the value is of vaccination in preventing the development of antimicrobial resistance. We're not necessarily capturing all the herd immunity benefits and the benefits of other people staying healthy. But it all goes beyond these health benefits as well in terms of the economic benefits. So we tend to measure things like treatment cost savings, hospitalization costs, and maybe some short-term productivity losses. It's much harder to really think about the wider benefits of the productivity losses, the impact of saving children and parents and people's lives that would have on the family, and the poverty that could be averted by preventing illnesses and deaths, the equity impacts that you could actually have by vaccinating both genders, and the economic growth opportunities that are there because people are healthier and can be more productive in society. So these are all these broader benefits that we need to also sell the value of vaccination when we're talking about it. So it's not just it's cost effective, but it can actually really go beyond those initial estimates that we're having a harder time measuring.
Thank you, Sachiko. What I'm hearing is focusing on some key messages that would ring the loudest with the policymakers. And I suppose it depends which side are these messages coming from, which profession. Is it coming from the collective? Is it coming from individual professional organizations? And that's why collaboration, interprofessional collaboration, becomes even stronger and more important here. Jane, I'm going to go back to you and ask again, if you have follow-up to Peter and Sachiko have just said, but also if you have some specific examples of successful initiatives, either the federation, your federation has been part of or have witnessed that have led to improved vaccination rates. That would be great to hear about concrete examples. Thank you.
Look, thank you, Lina. This is an evolving situation, isn't it? IFA was at the forefront of working to improve adult vaccination rates 12 years ago, well before the pandemic. And I think Peter has very eloquently described the shifting sands that were forced by a pandemic. And he also said, and Sachiko said also, you know, how do we maintain this momentum? So first of all, I think it's important to say champions are needed. These things don't happen by themselves. And it's also important to be able to translate evidence into action. And Sachiko does this beautifully. You know, what do the numbers actually mean on the ground? I think Peter is also trust is key. Where IFA comes from is that we actually look at the tough stuff. So two good examples, very concrete examples. We know that the largest proportion of people that died during the pandemic in any country, older people living in long-term care facilities. And every single country has an appalling, rate, every single country. So we conducted a 19-country study to first of all look at whether there were immunisation policies at the national ageing strategy, in long-term care strategies, in national immunisation plans. You don't have to be Einstein to actually know the results before we even go there. So not one country has immunisation within the national aged care or ageing strategy. So what that does is we shine the light. That's success, because we've not only identified the gap, we've actually said to all governments, you're on notice. The reason why, so many people died is because there were no systems. You're on notice. The other example is, and because what we do is we create knowledge at IFA. We use that evidence into advocacy, and Peter said it again, policy. If you don't have policy, you don't change practice. And then we communicate. Now, the second example is the National Immunisation Technical Advisory Groups, NITAGs. We actually investigated and interrogated NITAGs in 34 countries. What we wanted to do is look at the functional process indicators of WHO using a TAPIC framework, so governance, accountability, transparency, etc. We wanted to actually see whether this notion of a life course approach was actually evident in NITAGs, because it would seem to me that if there is a disparity in NIPs, we need to look at the expertise as well as governance, transparency, etc. 34 countries, 2 countries out of those 34 countries had any representation in their NITAGs from an expert that knew about adults, immunisation, immunosenescence. And I'm not saying that paediatricians don't know that, but paediatricians are there to advocate for younger population. And so once again, what we've done is highlighted a very important gap that could change very easily. If those 34 countries reviewed the NITAGs, the publicly available information, the governance, the accountability, composition, then we would actually start understanding the disparity and improve equity. My last point is SAGE, WHO, they do not have representation across the life course. So if SAGE doesn't have it, then why does NITAG? So, what we're doing is highlighting, using the evidence to actually then come back to WHO and say, we're here to strengthen these NITAGs because it's important for population health and it's important for older people. So they're 2 good examples. Thanks, Lina.
Thanks, Jane. These are really good examples, and sometimes, well, most of the time, identifying and acknowledging a problem is the beginning of the solution, and making it clear to the governments themselves is work to be modelled. Thank you so much, Jane. Similarly, maybe I'd love to hear examples from Esther about key ways in which vaccinate. Actually, no, I'm going to ask you about some the other question, because I think it links with Jane. Again, are there real world examples or success stories you'd like to highlight where vaccination has significantly improved health outcomes of aging populations? And I say this carefully because it's really hard to measure impact, but you know, success stories would be great to hear from you. Thank you.
Sure, thank you. And Jane so helpfully outlined the ways in which we, you know, the challenges we're facing and where we're not doing enough. But in many ways, the COVID-19 pandemic showed us what was possible. So we kind of don't have the excuse to sit back anymore. In terms of flexibility of delivery, in, you know, all the different places, it felt I got one of my immunizations in a race course, the other in a supermarket car park. You know, that we moved heaven and earth to make this happen, and it can be done. Working to identify and begin to rectify inequality of access. So the sheer volume of data we have now on COVID-19 far surpasses any other vaccine that is recommended for adults. So we have a much better idea now than we did of who has trust in the system, who presents themselves for vaccines, who needs to be communicated to in different ways. And then that allows us to adapt our public messaging and also clinician to patient one-to-one messaging to address concerns and help people understand the benefits of immunization for themselves and also for their community. So as we've touched on already in this discussion, every individual is so different in the ways that they'll respond and the things that will sort of keep their involvement with health services and with immunization, which to some degree is a risk. You know, most people are saying, well, I'm not going to get shingles, but that's definitely a needle that's going in my arm. And it's two very different things. That individual psychology is something we really can't lose moving away from the pandemic, of just how do we connect with people and get their trust and get them on side, not only for themselves, but as we've said, for the broader benefits of every society. So other panelists have mentioned the Immunization Agenda 2030, the decade of healthy aging, and how these match up with other agendas such as universal health coverage and pandemic preparedness. You know, there's a lot of work being done that's really exciting, but often it's chicken and egg. Where do you start with gathering data to identify why uptake of this vaccine is so much lower, but then you get into the recommendations of it's recommended for this age group in this country, but for different, there's so many pieces to the puzzle, and there's lots of reasons to be optimistic, I feel.
Thank you, Esther. And I think that's where collaboration between global organizations comes into place, because everyone has their role and their place. There's the identifying the problem, then there's the lobbying and the solutions and the data, and we can all work together to share some of these so that there's no duplicated work. We have about 10 minutes left, so it's just one more question to each of the panelists before wrapping up. So I wanted to ask Peter about any recommendations you have on how professional organizations can collaborate on a global scale together, and what can we learn from the Australian context?
I feel like as the closing question, that's just priorly me to say, come to the FIP Congress in Brisbane and talk to your global colleagues and to share some of your success stories, your challenges, and to reflect on what works and what might not have worked so well. Certainly FIP and FIP did a great series of webinars across 2020 and this one as well, helping share some of those strategies that sort of help with best practice vaccination management, because well, every country has its own challenges to some degrees. That if you look at enough countries around the world, you'll see all of your challenges somewhere else. So really trying to pull together what happens around the world. And FIP did a fantastic resource for member organisations a couple of years ago, which has been very useful for me and others in Australia that do policy work about what vaccines are available in other parts of the world, what have been some of those enablers. So as for member organisations of FIP, been able to benefit from that collating work that FIP has done is really, really valuable. And being able to talk about some of those global exemplars as well. It's there's reassurance in not being first. If you're not the first country or the first jurisdiction to do that, you can see how it's worked in a similar context somewhere else. There is a lot of comfort that provides to regulators, because a regulator's primary role is to be managing risk, and they're often in separate parts of health structures to public health teams, which are trying to manage overall benefits and like effective strategies. So really trying to understand the organisations, the people you're engaging with in a professional organisation role can be really good. But that's the advocacy side. The engaging the membership side is also really important as well. Depending on your membership, we represent pharmacists like everywhere else in the world. Pharmacists are burnt out and tired and have gone through a really rough period over the last few years. And it's there to continue to help really engage and inspire people with change. You need to make sure that you're working effectively. You're not trying to drag people too quickly into a new world, and you need to make sure your training is as up to date and as current. And we've talked a bit about the pandemic. I think it has shifted expectations on how rapidly information is disseminated. That once upon a time you might wait for a physical newsletter or journal to arrive in your inbox. Now, the second something's announced in one location, as a professional body, you need to have a response about how that's locally relevant. So I think some of those things about being able to be more innovative and modern in your ways of working are really important. But overall, I think empowering the vaccinating workforce to talk about some of these secondary benefits and beyond the just disease prevention is going to be one of the most powerful things that we can do as a professional body as well. Because as health professionals, we're very focused on the biomedical factors and risk factors and indications and adverse events. It's an additional layer of communication and understanding of vaccination to be able to have that conversation with consumers. And I think through this series, I've certainly seen that there are many more things that I could be talking about that may be inspiring some of my patients and the people that I serve or support in my practice in pharmacy. And I'll certainly be taking some of those strategies into my communication methods as well, and hopefully supporting other pharmacists in Australia to do the same.
Thank you so much, Peter. Really appreciate that. And similarly to the rest, this last question is going to focus on pharmacy. Really, we've had a very general discussion about vaccination. But Sachiko, considering the important role of pharmacists as key healthcare professionals, but also vaccinators, how can we use health economic research to further emphasize the impact of pharmacy-based vaccination programs, in your opinion?
So vaccines are one of the most cost-effective interventions in public health. And they're different from treatments because we actually have to give it to healthy people. And that means you actually have to have evidence to show that it's actually beneficial and safe and effective to give it to healthy people, and that it will actually have benefits, even when individuals, so that you can actually prevent people from getting sick and very sick. And I think it's really important for pharmacists to kind of think about their role in the community as the most accessible healthcare providers to be able to help people in ways that's not just administration of vaccines, but also other things, right? So it's about organizing campaigns and ordering and storing vaccines and reporting adverse events and accessing patients' records and utilizing those tools to educate and advocate for immunizations. And really kind of helping to address vaccine hesitancy in the community that's been developed through lots of misinformation that's been out there in vaccines, and informing immunization policies so that it's not that we just get the vaccines and try to deliver it, but also try to change some of the policies through advocacy, and reminding patients about immunization and trying to really educate them about them, because I think pharmacists play a really critical and essential role in the community to be able to reach more populations. And we've been able to see that Getting pharmacists involved in vaccination increases access and reach, and it really helps health worker shortages as well. So I think it's important to sell those pieces for pharmacists.
Thank you so much, Sachiko, for that. Jane, you're one of the biggest proponents and supporters of, advocating for the role of pharmacy in vaccination. So nothing new here, but it's never, it never gets boring to reiterate some of the key messages. Again, for some of the listeners with us today, tell us why pharmacy-based vaccination is important for older adults specifically.
Lina, I think that we've all agreed and we've confirmed that pharmacists are, the entry point for many conversations about health. But let me just provide a bit more of a sobering tone, which is a little bit different to what I usually do. I believe that the associations of pharmacists are really at a crossroads, and I'll tell you why. They've been at the front line for several years. They've been asked to stand up, to be champions, to do this, to do that, to spread themselves more thinly, to have different fridges, to restructure, to do this, to do that. In the country that I live in, they're being asked to do prescriptions now. We also, as civil society that are strong partners with FIP, need to look at the occupational health and safety, issues and protective mechanisms around this profession, because we know the frontline workers across healthcare professionals, doctors, nurses, they're dwindling. Why are they dwindling? Because they're burnt out like we are, like pharmacists. So I do think that it's the time, as Peter was talking about, the great changes in Australia and many countries around the world, it's now time to go, okay, let's pause and let's make sure that we have all of the health and safety mechanisms in place for this professional, because we depend on them. And that's why they are champions in the arena of healthy aging and immunisation. But let's actually shine the light on the health and wellbeing of pharmacists as we explore mechanisms to improve adult vaccinations. Thanks, Lina.
Thank you so much, Janet. A very important message, and I'll say maybe as just a personal reflection. When I was a child, I always wondered why on the airplane the pilot would say, put the oxygen mask on yourselves first as parents before the children. I'm like, that's so selfish, but obviously understood that very well as we grew up, that it's really oxygen mask first on ourselves, and that applies to the frontliners. Thank you, Jane, for that very important, sobering message. And last but not least, to Esther, maybe going a bit more practical about Esther, how can we work better together, FIP, ILC, other organizations? After having heard this discussion, what comes to your mind?
I mean, it's been a brilliant discussion. Thank you all so much. The first thing that comes to mind is the best way we can collectively advocate for improved adult immunisation is banging out the same messages, as you've said to Jane. It never gets old saying the same thing until it happens. When we're able to, we'll be singing from the same hymn sheet, we can really increase the amount of impact we are able to have, and we all do that from our different angles. So as I said, at ILC, we're a think tank, we're allowed to have the ideas, and for every other organisation, you can speak to how immunisation will improve things from your perspective. So my maybe final thought would be just hammering away at the benefits of immunisation, because as has been kind of touched on before, we don't see vaccine preventable diseases as we once did. We don't see polio, we don't see various things. So we're very distant from the impact of that. So we need to be continually reminding policymakers, health leaders, anyone who will listen. When we vaccinate, we don't only protect from that nominated disease, we protect from secondary conditions, any hospitalization and hospital-acquired infections. people can keep exercising, eating healthily, taking their routine medications, all of their health promoting behaviors. They can work, care, volunteer, and spend as normal. The benefits of immunization really are difficult to measure because there are so many of them. And I think if we're all able to drill down that specific message and get it out to as many people as possible, hopefully we'll see some more progress. Thank you.
Thank you, Esther, with ending by reiterating the key message of the whole event, which is vaccination has benefits beyond disease protection. And that's really important to understand, know, advocate for, and use to lobby for better policies, especially using pharmacy-based vaccination. I'd like to thank all of our speakers for this very, very wonderful discussion. Honestly, events like this are highlights of my daily job at FIP and reminds me of why we're here. I do hope we can do this more in person, but this has been really, really great. Thank you so much. And just as a last note, Peter is in Australia, and starting next week, we know that pharmacists will start flying to Brisbane for the FIP Congress, which is starting on the 24th of September. Peter, as our delegated host today, any messages you'd like to say to the pharmacists listening in and the pharmacy professionals?
Oh, well, thank you. And to those of you who are travelling to Australia in the next week or two to join us in Brisbane, a very warm welcome. I've already been running around Brisbane through the year filming a few short videos, so those that have registered will see some tips and tricks on how to the best places to get coffee, the best places to eat, and how to get in from the airport. So we're really excited to be welcoming the world to Australia. Brisbane is a city that is much warmer than Melbourne, where I am today, so it'll be very pleasant and lovely. And Queenslanders provide great hospitality, so it should be a fantastic event. I've always enjoyed travelling to meet colleagues in other parts of the world. I have special memories of every FIP Congress I've been to, and I hope those that are coming, or if you can make short last minute plans, do come and join us. Really looking forward to a week of fantastic collaboration in pharmaceutical science, pharmacy practice, and pharmacy education in Brisbane.
Thank you, Peter, for that informal welcome to everyone. Peter is not the host, but we've asked him for this message. Any final comments from our panelists before we close?
And just to say, Lina, thank you very much to FIP. I've had the great pleasure of being on several of these, and they're always inspiring to me and also help me be grounded in what my job is and the jobs of others around. And as I said on a webinar yesterday, civil society is a very powerful movement that can be good and strong partners with government, non-government, academic and industry. So let's do it all together towards a common agenda. Thanks, Lina.
Thanks, Jane. Any final reflections, Sachiko, Esther? Thank you so much for being with us today. We really appreciate this. We wish you all a wonderful day or evening ahead. Thank you to our listeners, and we look forward to hosting you again at the future. Take care. Bye for now.
Yep.